Hey everybody, it's Dr. Joe and Unicorn Callie, and today I'm going to show you general lower body isometric exercises. This is the 6th video in my 10-day whole body wellness challenge. And if you'd like to find out more about it and join in, stick around to the end. So let's get started. Disclaimer alert, disclaimer alert. So before we get started with the lower body isometrics, you're going to need a couple pieces of equipment. So the first one is either a ball, a yoga block, or even a folded up pillow to squeeze your legs into. And then you're also going to need a stretch strap or a dog leash or a belt, something solid, so not like those resistive bands, to also push out into. So we're going to start off with a warm up, and then I'll tell you a little bit more as we go. So let's get started here. So the warm-up is going to be a 2-minute warm-up. We just want to get everything nice and loose. Let's just start with some seated, not heated, hip flexion, but heated to warm up those muscles. So again, that's what we're just doing. We're trying to get those muscles warm. We're going to do an isometric routine, which is activating the muscles, but not actually making big movements that might be painful. So we want those muscles to be nice and warm, so when we're doing those contractions and activations, they're already loosened up and ready to go. With isometric exercises, they should be comfortable, they shouldn't be painful, because that's kind of the whole point, that you're not making those movements that sometimes cause pain. So let's go ahead and do some kicking out now, just again to get those lower leg muscles and the lower body muscles warmed up. With the isometric exercises today, we're just going to start off with maybe a little bit more now of like 40 to 50%. So some of the other days in the challenge, we started off with 30 to 40. You've done some of these before, so let's start bumping it up just a little bit, not a whole lot more, but starting to put a little bit more pressure in there to get those bigger contractions, but still not to 100% yet, because this is still kind of that beginner program. So now let's just do some kind of roll outs with the legs to get some of those rotators warmed up and activated. Nothing that has to be a hold for these. Again, we're just kind of getting that movement, almost that dynamic type movement, to get those muscles nice and loose, so we don't have anything super sore or super tight while we're doing everything. And then the last one, just to kind of get the back a little bit moved up as well, is just a little kind of a trunk rotation while we're seated. Again, this doesn't have to be a pause. We're not really doing a stretch. We're just loosening up those muscles, because we're going to be doing some hip stuff and low back stuff as well for the lower body area. So we're going to start off lying down, doing what we call TA bracing or transverse abdominis bracing. This is a little bit different than the pelvic tilts that you might have seen me do, where you're just actually activating the muscles. We're not really doing big movements. You can do a pelvic tilt and then do the bracing as well, but I'm just going to start doing the bracing. So put your hands on your hip bones and slide them in just a little bit. Now, try and contract those muscles. I often say like a fake laugh, ha 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 ha. And you should feel those muscles pushing back into your fingers when you slide in, maybe an inch or two from those big bony hip bones right there. Just pushing out, activating those muscles. Again, maybe a 3 to 5 second hold, and then relax. You should be breathing through this. You shouldn't be holding your breath, pushing those muscles out. You can see I'm talking through doing it, and I'm getting those muscles activated. You might not see a big movement with these, and that's okay. You really shouldn't have movement, just having those muscles pushing out into your fingers right there. So again, if you can't quite feel it, do a laugh or a fake laugh, ha 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 ha, and I can feel those muscles pushing out into my hand. So again, pushing out, that 3 to 5 second hold, and then relax. Not as hard as you can. I don't want you to feel, like you're pushing so hard that you're hurting yourself. Again, maybe that just 40 to 50% pushing into my fingers right there, pushing, 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 and then relaxing. So then the next one is going to be going into some hip flexion sets or isometrics. So with these, we'll just do one at a time. You can eventually do both of them at the same time, but it's a lot harder. So just bringing up your knee into about this position, placing your hand on your knee. This is the motion I'm doing, but I'm using my hand to stop it. So I'm just trying to push my knee up towards my chest. I'm activating those hip flexor muscles there and then relaxing. So again, with this, not as hard as I can push, just that 40 to 50%, 3 to 5 seconds. Some people ask about your toes. I feel like if you pull up your toes, that helps you get a little bit better activation. And then relax, push again, and then relax. So we're going to alternate sides just to give each side a little bit of a break, but same thing, just bringing that knee up, hand here. This is the motion I'm doing, but I'm preventing myself from doing that by pushing into my hand instead, activating those muscles. Relax. Sometimes if you haven't really done this a whole lot, you might feel like those hip flexor muscles are trying to cramp a little bit. If they are, then go a little bit less with your push. So maybe just like a 20 to 30% push. So you go at your own pace. That's what this is for. That's why we're doing it for time and not for reps. So if you have to take a little bit longer break in between each one that you're doing, that's okay. You know, even if you have to bring your leg back down in between each one. And again, if you've done these before and you don't need my instruction anymore, just put the mute button on and listen to some of your own music or whatever you want, because I'm going to be talking the whole time trying to just give you some extra detail and showing you ways to modify it if you want to or need to. So you kind of do whatever works best for you. So just again, pushing in. And you can see my leg shaking just a little bit. So depending on how hard you're pushing or if you have an injury or not, you might feel that a little bit. So again, just going at your own pace. The number I'm doing might be more than what you can do. So again, if you have to kind of reset between each one, definitely do that. So like for this one, if I push in for that 3 to 5 seconds, and then maybe I have to put my leg back down because maybe I'm really feeling that hip flexor work a little bit, and then coming back up and doing that again. That's completely fine to do. So then the next one is going to be going into a hip abduction isometric exercise. So this is where you take your strap or your belt or your dog leash and just kind of wrap it around just above your knees, around your thighs. So this time the motion you're going to be doing is pushing your legs out like this, but the belt is going to prevent you from doing it. So I'm just pushing out into the belt like this. So again, that 3 to 5 second pushing out both ways and then relaxing. That 40 to 50% if you think you can. We're going to do a couple extra ones of these because the outer hip muscles, those abductors, are really important in our walking and our strength in our lower legs. So just pushing out and then relaxing. So this is one that once you get the correct technique and you feel comfortable doing it, you can change the positions of your knees. So if I wanted to go now out a little bit further with this one, then I can push out so you have a little bit different angles while you're doing it. You certainly don't have to, but sometimes this just changes the position of the muscles so you're getting a little bit different exercise while you're doing it. So again, just pushing out and then relaxing. So you shouldn't see a whole lot of movement with these. That's that isometric exercise, just staying in one spot. And so again, if I wanted to go out even a little bit further with this one, I can. So again, that nice push and hold. Some people ask about, should I be doing a pelvic tilt with this? Yes, if you feel like you're usually out of a tilt when you're doing exercises lying down kind of in this hook lying position, you can do a pelvic tilt with it. I usually feel like I'm in a fairly neutral position, which is what you want to be in. But if you want to try and do the combination of both, you can. But I'd say make sure and master this first and feel comfortable doing it, and then try and get in that pelvic tilt and do that exercise as well. So I'm going to go a little bit closer now with these, just kind of changing the different angles. So again, if you want to kind of go into that pelvic tilt first and then push, you can. But if that feels like too much in the beginning when you're trying to figure stuff out, that's okay. Figure this out first and then add in the tilt after that. Nice big push out, 40 to 50%, and then relax. So then the next one is going to be for hip adduction, just in the opposite direction. So this is when you get your ball, your yoga block, or your pillow, and now you're going to put it in between your knees. Sometimes when I have slippery pants on, I have to hold it in place, and so you can hold it there, or if you feel like it's going to hold, that's fine as well. But now I'm just squeezing into the ball, getting those adductors or those groin muscles in there, and then again that 3 to 5 second hold, and then relax. Now, these are smaller muscle groups, so you might not have to push as hard. You might not have to do as much before you start feeling it. So go at your own pace for these. Sometimes people feel these a little bit more, so we won't do as many of these. But that squeeze and hold. And sometimes with these isometric exercises around the hip, you might feel a little pop, sometimes even in your low back area. That's fine. A lot of times that's in your SI joint area or your sacroiliac joint area. And that's just because it's opening up those joints. And so if you've got some little issues going on there, you might actually feel a pop. And as long as it's not painful, that's okay. Usually that's just kind of readjusting or getting that fluid moving in those joints. So then the next one is going to be up seated. And so now we're going to kind of redo those, but we're going to do them all seated. So it changes the exercise just a little bit. So this time we're going to go back to that hip flexion. So I'm bringing it up in this position, but I'm just pushing into my hand. So I'm gonna lift my foot up just a little bit so you can kind of see the movement I'm doing, but you don't have to. You can leave that foot down and then push up into your hand. So whatever, again, is most comfortable for you. Sometimes if your foot is not touching the floor, you have to work your hip flexor a little bit more, so it might be a little more uncomfortable. So again, if you wanna keep your foot on the floor and push up into your hand, that's fine. Make sure it's comfortable, it's doable, and it's not painful. So I'm going to switch back and forth on each side, because again, if you're feeling pain, you're kind of defeating the point of doing the isometric exercises, because that's really what the isometric exercises are for. You're not doing those big movements that might cause that pain. And a lot of times with these, make sure you're sitting up nice and tall too. If you have a back like your couch or your chair, support your back. But you don't want to be slumped down while you're doing these. You want to be up nice and tall while you're doing them. So make sure you have good technique while you're doing these. And then just pushing in and relaxing. And make sure your knees and hips are about in alignment, so you don't want to be so close and you don't want to be so far out. So you're just getting that nice neutral position when you're pushing in. And again, that 3 to 5 second hold, 40 to 50% if you can. Sometimes these hip flexors want to kind of spasm on you a little bit, or try and push back a little bit. So if you're feeling like it's trying to cramp up on you, again, maybe drop down to just 20 or 30%, or make sure your foot is on the floor. That actually helps a little bit, where it's not working quite as hard because it's not holding up your leg as well. And again, if you just want to do some nice deep breathing with these, a lot of that diaphragmatic breathing really helps relax those muscles. So that will help as well. Just get that nice deep breathing in there. So then the next one is going to go back to using the strap, going into that hip abduction. Sometimes when you're seated, you can get a little bit of a rotation with it, which will help kind of get the glute medius and the external rotators. So again, just the strap right above your knees, and then you're going to be rolling your legs outwards, but the belt is going to stop you from doing it. So just kind of pushing out into the belt for that 3 to 5 second hold. And then relax. And again, if you want them, a little bit closer, you can do that. If you want to, each time maybe go out just a little bit, you can do that as well. We're going to do some extras again of these because those abductors are so important, especially when we're walking. It helps kind of stabilize our hips and makes sure that everything doesn't wobble around while we're walking. So this time I'm going to maybe go out just a little bit and then pushing out. So when you're seated, some people also ask about foot placement. My feet are together. You might not be able to see that, but they don't have to be together. I just feel like I can roll out a little bit better when they're together. If you want to bring them out a little bit to where they're knee and hip width apart, you can do that. But I like keeping mine a little bit closer together because I just feel like I can get a better roll out at my hips. And again, even if you want to go out even further, again, to get that little bit different motion in there, you can certainly do that as well, just kind of changing that position in there. So just, playing around with the position of your feet, but also playing around with the width of the belt or leash or stretch strap around your legs. And you might find a spot where you're like, oh yeah, that's the spot that I need to work on because I can tell that it's working a little bit more. So everybody's different, and that's why I just want to give you a variety of things to try to see what works best for you, because what works best for you might not work best for someone else. And so it's nice to have some options to try a couple different things while you're doing it. I'm going to get a little bit closer this time while I'm pushing out. So then the next one, as you can probably guess, is going to be going back to the ball, doing our hip adductors, those adductors or those groin muscles. And so this is a really nice one, not only for the knees, but the hips as well. And then even going down a little bit to the inner part of the lower leg. And so again, just squeezing in for this one. You might have to hold the ball in place so it doesn't fly away from you. I like to deflate the ball a little bit if I'm using a ball because I feel like it gives me a little bit better squeeze in there. You don't have to, but I've just found personally for me that if they're slightly deflated, and then they also tend to not want to shoot out away from you when you're squeezing on them. So that's a little tip as well. And usually you can find a ball somewhere. And again, if not, if you don't have a yoga block or a ball, folding up a pillow works well too. Your knees are going to be a little bit closer together, so make sure it's a bigger pillow because you still want your knees to be about hip distance when you're squeezing in. If they get too close together, that kind of changes the movement a little bit. So make sure it's a nice thick pillow that you can fold up and then squeeze into, just so those knees aren't banging together and then causing some pain in there. So then the next one is going to be glute squeezes or glute sets. And so these are going to be another one that you're not really going to see it happen when you're seated. Sometimes you can see a little bit because when I squeeze in and activate my glutes, sometimes you'll see that you'll lift up a little bit. So sometimes it's easier to feel it when you're sitting versus lying down. But just squeezing in almost like you have to go to the bathroom and you're trying to hold it in, but still that 3 to 5 second hold, maybe just 40 to 50%, and then relax. So you can see I probably rise up just a little bit while I'm holding it, and then I come back down. You can also do these lying down either on your back or your tummy, but I just find that especially if you're at a computer all day long or something like that, these are things that you can do to keep those glute muscles activated because they're big muscles without having to do a whole lot of movement. And sometimes people don't even know you're exercising, but you can do them while you're working on the computer and not even have to worry about it. But again, that squeeze in, try not to go to the bathroom, hold everything in, and then that 3 to 5 seconds and relax. So nice big squeeze. And then coming back down. And again, if you feel like that's a little too much because you have that resistance of whatever you're sitting on and your body weight, if you want to lie down and try these, you can certainly do that as well. Sometimes that's a little more comfortable when you're trying them for the first time. So there you have it. Those are my general lower body isometric exercises. This is the 6th video in my 10-day whole body wellness challenge. If you've missed some of the other ones, make sure and click on the playlist up there to get more. And if you'd like to find out more about the challenge and join in, where should they click? Down in the description below. And remember, be safe, have fun, and I hope you feel better soon.